Hello and welcome to the Tips with Tony podcast. I'm Tony Marinucci, your registered dietitian, helping you get healthy one bite at a time. I am so excited for this next interview. I have virtually in front of me a really great friend and also someone who's just really great at her job. And fortunately enough, she was also a client of mine. So her name is Brianne. She will introduce herself in a moment. She's a physical therapist, and she's going to be teaching us how to heal our injuries and ways to talk to ourselves and really what it is that we need to be doing if we have an injury we want to get back to whatever we were doing before. So I'm so excited. So Brianne, welcome to the Tips with Tony podcast.
Tony, thanks so much for having me on. I'm really excited to be here today. I'm a little bit nervous, but I'm really excited.
Well, it's okay. I always tell people nervousness is excitement turned inward. So we just got to get you to just talk it out and then all the nerves will go away. But
Okay.
nervous is good because you care so passionately about what you do. And it's just, yeah, it makes sense. I was nervous when I had my first podcast too. I was nervous when I did a lot of things like the first time. It's like really nerve wracking. But anyways, I'm so excited for you. So let's have you introduce yourself by sharing who you are, what you do, and why you do what you do.
All right. So my name is Brianne Carroll. I'm a doctor of physical therapy. I've always had an interest in health and medicine since I was younger. I was very athletic growing up. I ended up swimming up until I was in college. I was an Irish step dancer. So I always had this in me where I was interested in athletics and human performance and in medicine. I wasn't really certain as to how I wanted to translate that into a career. So I went for my undergraduate degree in exercise science. And then I landed on physical therapy school at that time, graduated, went on to get my doctorate, and then started working. One of the things that drew me to physical therapy compared to some of the other health fields was the time you got to spend with patients.
Mm,
Because with that time, you get to really know people and you can create a more effective change that matters to them. You
yeah.
know?
That's so empowering to just have that. That's so true because unfortunately I think in healthcare everything is all about charting and notes, and that's one thing I didn't like about clinical as a registered dietitian is I felt like, because when you're in a hospital, like your main concern is to either go to the physical therapy or see the doctor or like worry about your meds with your nurses. Like nutrition's probably the last thing on your mind. You might care more when you leave. But I felt it, like the reason why you went into that is the reason why I was like, I need to transition to outpatient. Like that's a good point.
Which is funny because when I was working as a PT bedside in the hospital, sometimes we kind of felt like the redheaded stepchildren of like
Mm,
the allied health careers
hmm.
because no one ever died because they didn't get their physical therapy that day, but
Right.
it creates such an important ability for them to go back and live their lives
Hmm.
that that kind of feeling of like disregard, you're like, oh man, this stinks. I too like outpatient for the same reason you said, because
Hmm.
it kind of gets you out of that model and into a place where you have more time to connect with the people you're working with,
Hmm.
and that's where you can really utilize your skills in a bigger way.
Yeah, definitely. So what are the types of things that you often see? Like what are the most common maybe injuries or things that you see that people that you work with? Like,
So I've been fortunate enough in my career where I've been exposed to a lot of different patient types. I've treated everything from cardiac, pulmonary patients, neurological patients, orthopedic, post-operative, older adults, younger adults, some children. So I've seen a lot of different stuff. But what I have seen a lot of, I would say probably the bulk of my outpatient experience, I've seen a lot of chronic conditions, things like knee pain, hip pain,
mm,
back pain. And, you know, just because something's chronic doesn't mean you have to live with it. And
mm,
also, just because something's common doesn't mean it's okay.
mm,
Our normal state is not for us to be in pain. So as a therapist, it's great because you want to help people. But what I have found is because most of the patients I see have seen someone before they've come to see me because they need a prescription. So whether they've been to therapy before, they worked with a chiropractor, they saw a massage therapist, their personal trainer, whoever it was that they spoke to, the language that was used to describe what they have going on,
mm.
people really internalize that. So even with these conditions where they might seem fairly minor, there can be a lot of not just like verbal hangups, but a lot of internal hangups about what they have going on. And I find that no matter what it is they're coming for, if they've taken on this like negative connotation that and really internalize that, that in itself can make therapy or any intervention a lot harder.
Mm. So, can you give an example of like a language or a sentence that someone might come to you with that maybe was told by somebody else? Like, maybe what didn't even come from them, but maybe this is what they thought was the case. And like, how do you help them shift their focus to something more positive?
So for things that come from the patient themselves, you'll have someone who's 75 years old tell you that they've always had bad knees because they played a lot of ball, but they've never had, they always had an ache or a pain, but they were very active. And now they've gone from that to severe pain pretty quickly or more something that's really impacting their day. But they brush it off and almost have no expectation it's going to get better because they have this idea that either they caused it or they, just have to live with it. On the flip
Mm,
side of that, you'll have people who have gone and gotten x-rays. They had pretty minor knee pain, but they're told that this could be the worst knees that someone has ever seen. So as practitioners, we have, and I don't know if you experience this as much in outpatient as I do, but you even in outpatient, you have a lot of similar conversations with different patients over the course of your day.
mhm.
So for us, I find or at least for me, sometimes some of the language I'm using loses a little bit of its meaning because of the repetition. So I don't know that we're always aware of that. But when you're the patient and someone's telling you something about yourself and your health condition, those words really hit home.
Yeah.
And it's the phrasing like that where, although we want to validate people's experience, we want to explain to them what we see, what we found, we don't want to set them up to think that this is a terminal sentence of arthritis or something to that extent that we can't help them with.
Right, right. So what I'm hearing you say is that there is something that can be done, and sometimes the language, whether it's a client or they were told by another professional that this is really really bad, or like this is just something you're going to live with the rest of your life. There's ways to improve the quality of their life, and that might not necessarily be the case. But if you view it as that way, you're not going to be exploratory into getting help.
Yes, if you believe that there's nothing that can be done about whether it's your injury or a situation you experience in your life, then you're not going to take steps. You're not going to buy into the process to try and improve them,
Right.
which ultimately only does yourself a disservice.
Mm-hmm.
So, a big part of my job is patient education. So, I always try to, as I educate patients on, what their condition is and what we expect for them for therapy. But we do this after we talk to them about what their goals are because everyone's goals are different. Some people want to get back to running. Some people want to pick up their kids and not have pain. So we need to know what it is that's meaningful for them
Mm-hmm.
so that we can tailor our education and our treatment program to that. But in addition to the education, we need to encourage them. We need to say, a lot of people have this and they can do things. And I bet you can do things too. And you're having a lot of pain right now. And I think that'll get better. And this is what we're going to do to help it get better. But if someone's really stuck on, well, it is what it is, and they said it's bad, it's very difficult, no matter how good the interventions are and how much change you're making, is
Mm-hmm.
to get them on board with that.
Yeah, I mean, I think it's so powerful. If you don't believe that, if you don't believe in the outcome, like you're not going to take it seriously. You're not going to do what you need to do to help achieve said outcome, right? You really need to believe that it's possible. And I think sometimes it's helpful to have that the physical therapist to kind of like, you might not believe it 100%, but at least kind of have them like instill some of that confidence with you over time, and then I'm sure then they can start to believe it, because then they start to actually feel relieved of some pain that they never thought they'd be relieved of any pain.
Yeah, I think we as humans, as much as we know that other people experience similar things to us, it's very difficult for us to look at our own situations and take like general advice about it from others. And I'm sure you have similar experiences with your clients through your program as well, where we know certain things, but this is my thing. And it's hard to like accept initially that your advice is good and help, right? Because
Yeah.
we're hesitant to change because it's like, no, but like, I know you've seen others, but mine is this. And I think the confidence that comes from having a skilled practitioner or clinician say, I've seen this before. This is what I noticed with you. I think this will help you. You know, tailoring it to each person individually, I think is super important to make it relevant to them. But within that, it's celebrating their small victories and their small changes and saying, see, this worked and you thought you couldn't do it and now you can. And like, that's a big deal. Because the other thing we do is we tend to ignore our positives and focus on our negatives.
Yeah, that is huge. That is like literally my job. I feel like as a coach is to have people recognize all the good things that they're doing because they're so easy to dismiss it and just focus on the ways that they need to improve. And I'm guilty of it too. Like I'm not saying I'm not like, I think that's just maybe I don't know. I feel like that's how we're wired. Like we're just wired for success and we're wired to always be achieving and striving and doing something that we always feel like we need to be fixing something, but we don't forget to embrace the things that we don't need to fix and just to celebrate the things that actually don't need fixing and that work well, right?
Yeah, absolutely. And I just, for all things related to being a person, I feel like it just across the board, we harp on these negatives. And it's hard. Like I do it, you know, I do it. um it's this idea also, I think, of instant gratification. You know,
Yeah.
people, it's like the same way we all want something that's going to make me skinny quick and not going to require any effort, and I want to get back in shape, but how can I do it with the quickest, easiest way? And I want to feel better, but what can I do that it'll happen now? And it's hard because there are some things that can be band-aids for now, but we can't always sustain that. And
Mm-hmm.
I think a lot of the parallels between what you do and what I do are that we're trying to give the people we work with ways to sustain these changes so that they can carry on and focus on the things they want to do.
Yeah, definitely. I'm glad that you brought that up because I think there's a lot of parallels between dieting and rehab. And when I say dieting, I think in a more so in changing your lifestyle sort of a situation, like what it requires, like the differences, I guess, between like if you're kind of just putting a band-aid on an injury versus healing the injury. Whereas like with people might do like a detox or a cleanse or like a fad diet to like quote unquote fix their relationship with food, but it's really just putting like a prolonged, it's really not doing much. Like it might help a little bit, but it's really not getting to the root of what they really need. So let's talk about that. Like where have you noticed kind of these parallels? And yeah, I'm curious if there's more than I think there are.
I think there's a ton. And I think working with you kind of opened my eyes to how similar they are.
Mm-hmm.
But one thing that I really like is, you know, start with one small step,
Mm-hmm.
right? So, in regards to what I would do with someone, I don't like to give a lot of exercises up front that are like, go home and do these 15 exercises every day because A, it's overwhelming, right? I'm
Yeah.
super motivated week one. And then week two, I'm like, this takes a lot of time. I like
Mm-hmm.
to give people one thing that they can do. It doesn't, or that either relieves pain, improves something that they're like, I feel pretty good after that. And then I'm like, okay, then we'll add something else on. The same way you say, all right, if you're not working out, let's start. You're walking 4,000 steps a day because of your phone. Let's make the goal 5.
Mm-hmm.
I think those types of baby steps, kind of slowly building good habits, slowly building into how you're going to help yourself, is one of the big parallels. I think the other thing, like we were talking about, celebrating those small successes, you know, your relationship with food is not linear. You don't wake up one day here and all of a sudden you're here.
Yep.
Your relationship with your injury or your activity level is also not like that. There's a good day and a bad day. And I say it tends to trend upward if we're on the right track, but it's not necessarily a straight line. A bad day is not a bad life. It's not a bad
Mm.
fall.
Ooh, wait, repeat that. A
A
bad
bad day is not a bad life.
Okay. Yeah. Hello. That is powerful language. It's true. It's so true. Like we could have a bad day or a bad body image day, right? That
Mhm.
doesn't mean our body's changed, right? So like your injury might flare up a bit, but there doesn't mean you need to change what you're doing. You just have to continuously do your exercises. Like, that means like so when you're having a bad body image day, you don't have to go and do this restrictive eating plan. No, you just have to just trust, okay, today's a bad day. Let me just keep eating balance and trust the process and the pattern that I'm following because I know that's going to help me in the long run.
Absolutely. That and even one thing I do at my job is we'll do like a progress note and we'll check in on different parameters like strength and range of motion and speed of different activities or things like that. And it's a paperwork headache typically for insurance, but I like it because it brings attention to the things that, hey, when we first met, you couldn't do blank, and now you can.
Mhm.
Because as you get better, you start to take it for granted. And I'm saying, this is your work paying off.
Mhm.
I don't come home and do the exercises for you. You see me twice a week and you live the rest of your life.
Right.
So I like for people to see that as well, because, the work you're putting in when it's paying off, it's hard to see it on yourself. It's great when you hear it from other people.
Mm. Mhm. Yeah, I mean, so I guess to that point, with injury, I think the mindset you could be free from pain, but I think will you always have to I guess it depends on the injury. I feel like
Yes.
you probably always need to still be doing some kind of physical therapy, but probably not as much or as frequent in the beginning as you start to heal. But is that true? Like once an injury, always an injury kind of a thing, or does it depend?
I really believe it depends.
Hmm.
There are certain conditions that are more chronic, right? Like if you have, like I know you have like chronic low back pain, and you have times where it gets better and it gets worse and it gets
Hmm.
better and it gets worse. For me as a therapist, I'm never going to say to someone, you're never going to have to deal with this again. Because as humans, we're built to move. And with
Right.
movement comes opportunities for things to go a little bit awry.
Hmm.
But what my view of physical therapy has always been is that I want to help you get better and I want to teach you ways to help you keep yourself better.
Mm.
Like a
Yeah.
good PT is like a good mechanic, right? You want to go in, get what you need fixed.
Hmm.
You want to help maintain everything to keep everything else running. And you want to go home knowing that
Yeah.
you made a good call. You want, if something else happens, to have someone you trust to go back to because it was good service. They didn't rip you off. They didn't,
Hmm.
they
Hmm.
did the right thing by you. So, the current model of physical therapy is that we only go when we're injured. There's a lot of people who think we should have more of like a dental model, like you come in twice a year or once a year. We check on
Huh.
your overall health and wellness and mobility. If we need to do like a tune up of some kind of work on a couple of things, get to where you want to be, and get you out so that as we go through the aging process, we have, a list of, hey, like, you had a little problem with this 2 years ago and you've been okay since, or hey, you didn't have that and now you're having some balance trouble, as a way to help people before they get hurt.
Yeah, wouldn't that be amazing? Wouldn't it be amazing if the in the United States, they covered like seeing a dietitian before someone got diabetes? Wouldn't that be great? Like,
Are you talking about prevention?
you mean prevention of care rather than treatment of care? Like, what?
It would be incredible.
That
And
would be amazing. Do you know how much less of everything we'd see?
yes.
Like,
Yeah.
oh my gosh. Yeah, I mean, I support it. Is that actually going to happen, do you think?
At this
Or
point, I don't see it
I
happening.
know, it's so sad. Isn't
It,
that
it's
so sad? We're
it
such a
is.
society.
Mhm.
Like it's just always and like you said, it's like everything is just like quick and fast and like worry about it then. It's like, well, if you worry about it now and like not then you don't really won't ever have to worry about it then.
Yeah,
You
and
know?
but what is hard with that mindset is that you're told there's nothing we can do about this. You can take a pill, whether that's a pain pill or anything else,
Mhm.
or a medication to keep your blood sugar lower rather than modifying diet for, type 2 diabetes. And what's hard is to try and educate people that, you can do this on your own. It's not easier. It's definitely not easier, but
Right.
in the long term, it's better for you.
Mm-hmm.
So I know PTs, there's a shirt I saw on Instagram from some of the accounts that say exercise over opioids,
Ooh.
which I love. I love
Mm-hmm.
it because we want people to get moving before they get to the point where they have this chronic pain and then they become reliant on something like opioids
Which
or
is a serious issue. Like it's a real common problem right now that a lot of people are getting hooked and they're becoming quote unquote drug addicts because they can't go a day without pain. Do you watch Station 19 by any chance? The
little
TV show?
bit,
There's
little
one guy, a firefighter, like that happened to him. He had this injury that he got, and he got hooked on opioids. I don't know if it was opioids exactly, but anyway, it was like, and now he still always has to do that work and stuff. But like, if he had never gotten that injury, chances are that would have never happened, right? If physical therapy was pushed more so than the pain, just the pain,
yep.
who knows? I mean, actually, I'm kind of glad that you brought that up though, because like, what about the person that is just taking maybe, hopefully not, they're not taking opioids or anything like that, but maybe like Advil or Tylenol, to manage their knee pain or their shoulder pain or, like, to what extent is that okay? And when does someone maybe need to do a little bit more, a little bit extra, or like seek help? I don't.
Yeah. So it's a tough question to answer just because every body is different
Yeah.
and everyone's pain is different. One of the things that's tough about addressing pain is that as much as we have visual scales and numerical scales, you
Yeah.
can never
Your
ever,
perception.
yep,
Mm-hmm.
you can never ever actually know what someone else's pain is.
Mm-hmm.
It's subjective to each and every individual. So, you know, for someone who has migraines, they may say their migraine is a 7 out of 10 or an 8 out of 10. And you may meet someone who has a regular headache and be like, oh, it's a 10 out of 10. Well, I mean, you're walking around, you look okay, but that's your 10 out of 10. It is what it is.
Right.
With chronic, like, oh, my shoulder hurts when I do this or my back hurts when I do that, I always get a little nervous just because, you know, over the counter medications can have an effect on your body. You don't want to use too many of them. They can adversely affect your stomach.
Mm-hmm.
They can become less effective as you use them more, and then you need to take more.
Mm-hmm.
But also, too, my concern with that becomes if something's hurting, your body's saying, "Hey, pump the brakes," in some way, whether
Yeah.
it's that it's an acute injury or a chronic injury, but there's something happening there that needs some attention.
Mm-hmm.
um you know in addition to wanting things to be fast and fixed right away, I think a lot of us have this no pain no gain mentality, and that's something else that comes up in therapy. The no pain no gain mentality, I don't really believe that. I think, if we're referring to pain as like hard work and effort, okay, like you do need that to get improvements, right? We need to progressively overload, we need to make changes, but it shouldn't hurt.
Mm.
So I always I wish that it was easier for people to pop into physical therapy, to see like, hey, my shoulder kind of hurts when I do this every now and again. What can we do? Because I the amount of people who are just taking an Advil and going to the gym, it's you want them to be okay, you want them to keep doing what they're doing,
Mm-hmm.
but with the right PT, the right trainer, you can modify it, keep them doing what they want to do, but try and get better, whatever it is that's underlying it.
Yeah, definitely. And I was like a random thought, but as you were talking, um, I was thinking about when I went to physical therapy for my lower back. I was just so impressed by how incredible the physical therapists like really know form. Like they really know form. Like meaning like so I think a lot of times too, if you're just popping an Advil and now you're doing like an exercise the way that it's like just aggravating your shoulder more, like just go to like one physical therapy appointment so they can like show you the proper form so you don't aggravate it more.
Yeah.
Like it's really amazing. Like like that was the thing that I was like, wow, like I thought I knew I thought I had good form. Like I thought but no, like the littlest adjustments in like the way that my foot would go out and things, it was just makes such a difference in how things feel.
Absolutely. And that's what the benefit of going to a physical therapist is. Physical
Mm-hmm.
therapies are mobility experts.
Mm-hmm.
Every one of us is not skilled in like how to properly lift with the Olympic, like for the Olympic lifts, or, not all of us were great baseball pitchers that can answer all of those questions. But our education is so much centered around the anatomy and the kinesiology and how things are supposed to work, that if you like for advice like that, that's what you want to come in for.
Yeah.
You want to go to someone who appreciates what you're doing, has an understanding of what you want to keep doing, and can help you do that.
Mm-hmm.
And I tell people all the time, like, if you are not happy, shop around. There are a ton of PTs out there. You will find someone that gets you, that gets your sport, that gets your lifestyle, that understands your need. Because once you have that great teamwork and connection and communication, the improvements are huge.
Yeah, because I think too, like when you work with someone that you like and you enjoy seeing, like then you maybe like any form of relationship with, you can be honest with them. So you could tell them like maybe the reason why maybe you're not doing your PT is maybe you're going through a breakup or something. Like you don't have to be like worried about them judging you for like you telling them like why you're not doing the things rather than them looking down on you for like, oh, you didn't do your exercises. Like, no wonder why you're not getting better. Like, you don't want that. You want a positive relationship. You want to have someone that you can openly communicate with. And then also, too, like, kind of, you want someone that's going to motivate you.
Mm-hmm.
That's going to keep you accountable. And like, I think from the beginning, when you kind of said like you start people with like one exercise, I think that's amazing because when you feel overwhelmed in the beginning, you don't feel like you can do it. And then you burn out, and that's how you kind of give up and you're like, oh well, I'll live with this pain forever. And like people do that in their weight loss journeys, like, oh, I'm gonna be overweight forever, like, I may as well stop trying. And it's like, no, it's just we gotta go slower. we
Mm-hmm.
gotta we gotta be more consistent, not try super hard, still try, put effort forward, but it doesn't have to be like this massive shift and change overnight. And I think if you're working with the right professional, they're going to guide you in that way.
Absolutely. In working with people, you want to have understanding and you want to provide accountability. And that's somewhere
Hmm.
where we both overlap.
Hmm.
And that encouragement is so huge
Yeah.
because I heard something the other day. A friend of mine is a therapist, and she said a study came out that the most effective like therapeutic medium is that the therapist cares that you get better, not CBT, not electroshock, like not it's
Wow.
that they care that you are getting better. And I think that's so true, whether you're coaching or treating, that if you're invested in your client or your patient and they know that, it makes it so much more valuable, the
Mm-hmm.
therapeutic relationship, the teamwork, and the progress.
Mm-hmm. Mm-hmm. Yeah, I think that's a good point because I wonder if anybody who's listening is either working with a physical therapist or a dietitian or something where they kind of feel like that person kind of feels like I'm just going through the motions and this person doesn't care too much whether I succeed or not. And like, I hope that you realize that you deserve better. So anybody who's listening, if that's your experience, like you deserve better. It's okay to shop around. I know it's annoying. It's like, shopping for a car, shopping for a house, it takes time, but once you find that perfect fit, you're just like, oh my God, this is my forever home. Like this is like perfect. So it's so worth to look around so that way you can, be on that path to healing, or it may not be even be pain free, but I think less pain, is better obviously than daily pain or whatever.
Absolutely. And that's even, I always like to ask my patients when I meet them for the first time what their goals are for therapy. And honestly, sometimes people come in and they're like, I don't know.
Yeah.
I'm like, okay, well, so we kind of go through like things that give them trouble, stuff like that. But they'll say things like, it just hurts every day when I leave work. All right, so let's make the goal that it only hurts 3 days a week, right?
Mm-hmm.
2 more pain-free days is two days. And
Mm-hmm.
it seems so minimal, and people are often a little bit skeptical. But if we can get more good days, that's a start to making things better.
Yeah.
But again, it's trying to find a goal, make it achievable and measurable, because once that happens and you realize, hey, it didn't hurt today. It's nice to be like, okay, this is working, you
Yeah,
know?
like I actually had a day where I didn't experience pain. That means I could potentially have 2 days where I don't experience pain.
Yeah.
You know, it's like when people I work with who struggle with binging, like I can't even tell you how amazed they are that like before working with me, they might binge like most days out of the week. And then it's like they can't believe they hadn't binged in like a whole month. And it's like, well, it didn't start where you're not at a whole month. We started with like we got through a week, no binging for a week. Then we went through like one more week, then a week after that, right? And it just accumulates over time, but we're not focused on that. We're focused on the day-to-day stuff.
Yeah. And I think in our day to day, we tend to have this all or nothing mindset. And that's
Yeah.
the other thing that I think is very similar between what we do.
Yeah.
And it's hard because I very much had that. And working with you, you know that I had that. But I've always been like at work able to bring that to my patients where we don't need, it's not all or nothing. It's not black or white. We're making progress.
Mhm.
When it came to myself, I did not share the same grace for a very long time.
It takes time, right? But what did it take for you to give yourself some grace?
Um, Having the support from working with you was very, very helpful. And also just recognizing that, I am no longer a full-time athlete. I am a professional. I have a job. I have other like life things. I
A
can't
good point.
pretend that I'm going to be able to
Yep.
do what I used to do and be active, you know, 10, 12, 14 hours a week
Mhm.
on top of what else it is that I do.
Mhm.
So saying, all right, well, I haven't really been into working out, so I'm going to make my goal this week twice a week. And I did it and it's consistent. And then I would say, maybe next week I'll do 5. And you'd say, why don't we shoot for 3?
Mhm.
And if I get 5, great. But if I get 3, I did what I set out to do. And knowing that I was slowly building, a healthier mindset around my activity level, I thought
Yeah.
was really great. And it did take time. And there are some days where, I have a Peloton now and I love it. But there are some days where I'm like, well, why would I just do 20 minutes? And then I say, well, why not do 20 minutes? It's here.
Mhm.
It's better than nothing. I'm thinking about doing it. May as well get on. So the baby steps were really great for me. But to me, the accountability was huge.
Mhm. Mhm. I think what we did was we one removed your previous expectations, right? So the fact that you just said I'm no longer an athlete, like I think that's important to hear because if you compare yourself to the old version of you, and if it's something like when you were an athlete and to now you're a professional, like trying to like survive and like live your life, it's just that's when you're an athlete, that's you're dedicated, you can go all in. And that's what I don't think people recognize. So like when they're looking up at influencers on like Instagram or athletes and like they're like, oh my God, I wish I could run that much, or I wish I could have that body or whatever it is. It's like they forget that that's what they're dedicated their lives to do. Like that's that. But you're likely, if you're listening to this, you're dedicated to going to work, feeding your kids, have, living a life like, there's like basic, just life stuff. Like that's not your main priority, right? Going to school, whatever it is. And so I think that that shift in the expectations was definitely, that's the first step for anyone. You have to always set realistic expectations. And then, yeah, I'm glad that I think for you, because the all or nothing mindset and also your, you were always, I love you, but I think it's the athlete in you, like so hard on yourself, so hard on yourself.
Very
Like
much so.
very much so. It was like you're so compassionate for everybody else, but like when it comes to you, like there's no room for error. And
No,
so
absolutely
like
not.
but that's what I think what was helpful when you say the accountability. I think because we just like I had to constantly remind you that like you are doing amazing and that you are making progress and it doesn't need to be perfect right away. Like I think that was like super helpful. So I hope anybody who's listening, I know you can relate to that and just know that like it doesn't have to be perfect. Actually, perfection's a lie. There's no such thing. And it's to getting you further away from where you need to be.
Oh, 100%. And even with those expectations, just like you said, like I'm no longer an athlete. Like that level of athletic time per week is just not realistic for me right now. Hopefully someday it is again.
Yeah.
But that's not now, and that's not what I need. And I enjoy the way I work out and eat and live now.
Yeah.
One thing that comes up with me at work a lot is a lot of people like to blame their weight on their injury
Mm,
or their injury on their weight. So people will say things like, oh, well, I've put on a lot of weight. Like I used to weigh 110 pounds and now I have back pain and I weigh 150 pounds. So I'll say, weight loss can help. They say that reducing, if you're overweight or obese, reducing body fat or your weight by 10% can
mhm.
help reduce a lot of health related conditions. Absolutely true. However, if you've been the same weight for a long time and you woke up with back pain a month ago, I don't think that's your weight because you didn't put that back pain on, you didn't put that weight on 1 month ago.
Exactly.
So I really don't like when people blame all of their, or someone tells them that their injury is only due to their weight.
Mm,
And the other thing is when people get hung up on, well, I used to run, I used to love to run. I'm like, well, when was the last time you ran? And they'll say 6 years ago. Okay, so you were a runner then. It's something we can build back to, but you weren't cranking out 20 miles a week right before you got injured. So I don't think that's what this is.
mm.
And then sometimes people will say, well, if I just lose the weight, I think I'll be fine. They're like, I used to weigh 100 pounds. You also used to be a baby. Like you're no longer a baby. You no longer weigh 100 pounds. And you don't need to be that. You need to
Right.
be where you are.
That was amazing. Yeah. No, but it's so true. It's so true. Like so many women too, like want to get back to like I work with a lot of women who are like in their 40s and they had babies 10 years ago and they want to get back to their pre-pregnancy weight and like sometimes it's realistic because it's not that far off and then other times I'm just like wait a minute like that you were just living such a different lifestyle then like it's really like can we just maybe let's focus on like 10 to 20 pounds like we don't need to go all the way back to 20 years ago. You know what I mean? Like sometimes it's important to recognize that some because you put these expectations, it goes all back to like setting the right expectations. It's like let's just focus on the habits, the behaviors that we need to implement and
How
like
you
just
feel.
trust what happens and focus on how you feel. Yeah, you want to feel. Exactly.
That's a big thing for me too. Is like people will come in and I'll say, "How do you feel?" They're like, "Oh, I'm pretty good," and then I have to check off at some point like a pain scale rating, and then they're kind of like looking for it, like I don't know, I guess it's like a 6. Well, you don't have to hunt it. Like I just want to know
Yeah.
where you are today,
Yeah. Yeah.
because if you are having a good day, that's a good thing, right? You
No
came
doubt.
in a lot of pain, you couldn't do these things, and now you can. So let's focus on how good you're feeling and figure out ways to make that even better.
Yeah, definitely. Ah, this is so good. Okay. Is there anything else that we didn't talk about that you wanted to talk about today or
I don't think so. We really covered a lot of it, like I think just the language that we use when we talk to our clients and our patients is important. And I think as people who have been clients and patients, we also need to recognize that just because someone says something in their, explanation or their description doesn't mean that that's all we are, right?
Mm,
I have arthritis. I'm not arthritis,
right,
right?
exactly.
I
Yeah.
have fat. It's not that I am fat. I also have
Yeah.
fingernails. I am not fingernails. Like,
Yeah. Yeah. No, it's true. It's so true. It's so so true. Oh my God, this is so good. All right. So where can people find you if they want to maybe follow up, ask you any questions? How can people get in
uh,
touch with you?
the best way to get in touch with me right now is through my email, which is bcarrollpt@gmail.com. I'm open to any questions, be they PT related, podcast related, snowboarding related, throw it at
I love it. All right,
me.
so I'll put that in the show notes. Thank you so much for being here, guys. I really hope you enjoyed this episode. If you did, take a screenshot of it, share it on your story, and tag me at tips_with_Tony with an I. Thank you so much for being here. As always, I'm Tony Marinucci, your registered dietitian, helping you get healthy one bite at a time.